Well, on to this now. Many countries around the world are still monitoring the new Omicron XE variant, which emerged in the UK amid a surge of new COVID-19 cases. So far, there is not enough evidence to draw any conclusions about its transmissibility, severity, or vaccine effectiveness. But should Africa take action before this new variant strikes is the question. Joining us to discuss what course of action the continent should consider are medical experts, Dr Hannah-Lisa Tetteh in Ghana, Dr Vivek Solanki in Zimbabwe, and joining us a little later on is Dr Uyilawal Okhuaihesuyi from the Delta State in Nigeria. A warm welcome to all three of our guests joining us this evening. Thank you so much for your time. I suppose, Dr Hannah, we'll start with you. I mean, since that first case, just over 2 years ago, we've had 4 different waves of the coronavirus on the continent, each one presenting us with unique challenges. From your perspective, how have we managed to, handle this pandemic, and how would you rate, I suppose, our capacity as well to manage the pandemic?
Well, thank you for having me. So speaking about our capacity, I suppose you're asking about Africa. So I'd say Africans have been, very good, very bad, moderate in the management, in the sense that when it started, it took a while for people to actually believe that it was a disease that could affect Blacks and Africans as well. There was the influx of information all over the place, and then the influx of our cultural beliefs, and then our religion, and then low illiteracy rates also made it difficult for us to implement everything that WHO was recommending. But it took a while, and then African leaders were able to get the message across to the people. Then the restrictions became stringent. People were practicing the safety precautions. And then when the issue of the economic and financial challenges came on Africans, or were realized by the African governments, and I think that the restrictions were a bit reduced because people had to eat. So they had to do things such that it was a bit reduced. And then people started dying in Africa. They could see that the numbers were increasing, the number of infections were increasing, the number of deaths were increasing. And then the African governments took over a stronger approach again. And now we are back to, in some countries, no restrictions at all. And then in other countries, reduced restrictions pertaining to COVID-19. So I must say that it's been strong in certain instances, weak in certain instances, and then in the middle in certain instances.
Just to add on to what Dr. Tetteh has said there, I recall certainly at the start of the pandemic there being a lot of concern around a shortage of health practitioners, a shortage in medical supplies, logistical issues just in terms of getting certain needed items such as water to certain remote areas. And I wonder if, in your opinion, whether or not since then we've improved at all when it comes to some of these early onset challenges that we had to deal with as a continent, kind of dealing with this pandemic.
Well, yes, I think it became better because the World Health Organization was speaking against it, encouraging the stronger, more developed countries to give aid to the financially lesser and then developing countries. And I think that with us, Ghana was one of the first countries to be supplied with the vaccine. But then it got to times that there was shortage because with the PPE, the personal protective equipment, we were struggling because you can't expect somebody to change their overall as many times as they need to because there were not enough. So they were restricted to places where were designated to taking care of people who had been infected with COVID-19, whereas in other places it was generally the whole hospital. So yes, it got better, but it didn't get as better as with the other countries who were more at an advantage because they were financially stronger.
Right. Well, I want to bring in Dr. Solanki to the conversation. Dr. Vivek Solanki, I'd like to bring you into the conversation right now and just ask about issues around controlling the pandemic. We have a new COVID-19 variant that's emerged, XE. Very little information currently on the variant, but a lot of talk around controlling the pandemic. What does that look like? Especially because we know no country is the same when it comes to dealing with outbreaks and certain waves.
Thank you. So at the moment, the problem is the new variants and the recombinant alternatives of the Omicron, right? It's called the XE, the BA1, the BA2. There are multiple Omicron variants going on at the same time. And this is particularly so in Europe, Western America, and our problem in Africa is that they will be coming to us soon. Now, in those countries in Western Europe, and that all the restrictions have been lifted, and people are not wearing masks when they go out, they're attending parties, they're going to restaurants, they're attending soccer matches, and there are no restrictions at all. Now, the fear is, of course, this is going to come down to Africa. Now, a country like Zimbabwe, of course, we still got some restrictions where people have to wear their masks in public places. You cannot go into a shop without your mask. There's restriction on the number of people attending a funeral or a wedding, church gatherings, and all these kind of things. Now, so while our countries are maintaining the status quo and the numbers are very low in this part of Africa, our fear is of the onslaught that will be coming this way. Important thing to note is the XE or the Omicron or the Delta Omicron, whichever variant comes down at the moment, which is prevalent in Europe, is fairly mild. It causes mild illness. Yeah? The only confusion that comes is that the difference is between it's a flu-like illness or is it Omicron, and there are about 12 known symptoms that we differentiate it with. So we have the flu-like symptoms, and how do we differentiate whether it's Omicron or flu? Is that people on top of the flu symptoms, they also have gastrointestinal problems. They have nausea, they might have vomiting, they have diarrhea, stomach cramps, and that's how we're differentiating. Because the tests up to now are not very accurate. So one has to be careful, is it Omicron or is it not? Mostly because of its contagiousness. It's 10% more contagious than the Omicron, so one has to be careful of that and cognizant.
I mean, you've mentioned the fact that it is 10% more contagious, and I've highlighted that high transmissibility of XE. But it's coming at the same time as all of these COVID-19 restrictions are being lifted. In South Africa, you've mentioned certain restrictions being lifted in Zimbabwe as well. And I'd imagine a number of other African countries, in fact, are considering similar relaxations. Is that the best course of action when faced with a new variant, and also knowing that other variants are likely to keep popping up every so often?
Yes. Remember, at the moment, there are about 4 or 5 different variants concomitantly creating infections in patients. Now, of course, we have released or relaxed our regulations and restrictions. We've had to do that, obviously. You know, there's that fatigue from people having been locked up or been restricted to stay at home or not being able to travel and things. So I think we have to follow the world and we have to open up. In a way, it's good because Omicron is so mild, it's acting as a vaccine itself. So if you get an infection from Omicron, which is fairly mild, it's a flu-like illness, you stay at home for about 5 days, extremely low rates are getting hospitalized. So it's working as a vaccination on its own. It's immunizing the people, and it's protecting you from other variants that will be popping up as well. It's almost as good as getting vaccinated through an injection.
Dr. Okhuaihesuyi from Nigeria, I'd like to bring you into the conversation at this particular moment. We've heard from Dr. Tetteh about, how capacitated we are as a continent in dealing with COVID-19 as a pandemic in general. Dr. Solanki, of course, has given us more information with regards to the new variant XE and what we can expect in terms of symptoms and how to deal with this new variant. But I wonder, from your perspective, whether or not you think as a continent we're ready for whatever impact may come from this variant or any other variant that is likely to prop up.
Thank you very much. The COVID-19 XE is just a wake-up call for African nations. Most times we tend to throw caution into the air while not investing in research and in our health sectors. The pandemic made us realize that the health system is lagging behind, mostly in these third world nations in Africa generally. If not for those abroad, just for some handful of countries like South Africa, most of the health sectors do not have proper research institutions where these researches can be done. Most of us do not enlighten our populations concerning those illnesses. The flu-like illness caused by COVID since 2020 February, like in Nigeria here, and most of us have thrown caution to the air. We need to start strategizing and paying more attention to funding of the health sector, because now, just because of the COVID-19, these new variants, people now don't even obey the basic rules. You see people going to watch football matches in the field, people going to churches, people going to mosque, people not wearing face masks, people not honoring simple hygiene. The government first, on the African side, do not invest more or do not add more to the funding of the health sectors. In Nigeria, as we speak, we have less than at least 3 to 5% of the budget to fund the health. And we basically need to now depend on Europe and the US as arms to give us vaccines, to give us PPEs, to give us basic things to take care of our own. I know in South Africa, people have done well in research and done well in trying to cater for people that are infected. But this we need to improve more on in Africa generally. African leaders should learn to be able to pull more finances to the health sector. They should be able to provide the basic health requirements anywhere to all Africans. We should be able to do researches. We should be able to offer the best international practices to all people in Africa. More attention should be drawn to us. More attention to be drawn to the health sectors. More attention to be drawn to all people in Africa as well. Thank you.
Thank you very much, Dr. Okhuaihesuyi. We're going to go for a short break. On the other side of that, we continue with our conversation around the general preparedness that Africa has when it comes to dealing with any new COVID-19 variant that may pop up. Of course, the most recent being the XE variant that we're now in conversation about. Do stay with us. All right, well, we continue with our conversation around the preparedness of the African continent in dealing with any new COVID-19 variant that may, in fact, come into play. In our conversation today, we're joined by health experts, Dr. Hannah-Lisa Tetteh in Ghana. We're also joined by Dr. Vivek Solanki in Zimbabwe, as well as Dr. Uyilawal Okhuaihesuyi from the Delta State in Nigeria. A warm welcome to all three of our panelists. I want to come back to you, Dr. Vivek Solanki. You know, earlier this year, there was an interesting statement that was put out that Africa was on track to, in fact, controlling COVID-19 in the year 2022. You are stationed in Zimbabwe, a SADC country that is facing a number of challenges, primarily challenges in its public health system. And I'd like to hear from your perspective if you are in agreement with the statement that we are in fact on track to controlling this pandemic by year's end.
Yes, in fact, I was one of the propagators that said that we are doing well. I speak for SADC region, obviously, because I work in the region. And we have done extremely well in response to the COVID pandemic. The start-off was a bit slow. However, we have learned fairly quickly. We have disseminated information to the public through the various media outlets, social media, the television, the radio, public speaking throughout the region. The population has been fairly disciplined and obedient, and people have been following the restrictions. People have been staying at home and not doing unnecessary travel. They've been wearing their masks, cleaning their hands frequently, being cautious on buses and public transports. And the government's responses throughout the clinics and vaccination programs have been exemplary. We were one of the first countries to start vaccinating our population as early as February 2021, and we have got over 30% coverage to date, and health facilities have been upgraded to have the equipment and the beds available. Experts have been trained. Healthcare workers, over 3,000 healthcare workers were trained over a period of 6 months in handling the COVID pandemic, in the disinfection, donning and doffing effects. Specialty hospitals have opened up throughout Zimbabwe and even in Zambia, Mozambique, Tanzania, Kenya. And so, following, of course, South Africa's example and what we have learned through the WHO and the response of the Western world. So I would say, yes, we have responded well. And in fact, since 2021, we have been battling the COVID vaccine fairly successfully. If you look at the numbers, they speak for themselves. Right now, we have less than 30 cases per day with 0 deaths happening from the COVID cases. The dissemination information has been fantastic. Although we have lowered our restrictions at the moment, no PCR tests are required to enter or leave the country. Vaccination cards with the QR codes activated have to be presented and are strictly adhered to. And of course, travelers are still insisted on wearing their masks and keeping their distances and disinfecting frequently. So Africa, in this part of the world, has done fairly well, and I think we are well prepared for anything else in this COVID pandemic that's going to come our way. Thank you.
Thank you, Dr. Solanki. I'd like to come to you, Dr. Tetteh. You know, talking about the SADC region is one, of course, element, but talk to us about the situation in Ghana, for instance. I mean, we've heard how in Zimbabwe and South Africa there have been all sorts of upgrades and improvements to health facilities, increased in health practitioners and their availability to aid should another wave sort of come upon us. But I am curious about the situation in Ghana. Are similar improvements happening there for such a categorical statement as Africa is ready to control the pandemic by the year 2022?
Well, although Dr. Vivek makes very excellent points, I wouldn't say that Africa as a whole is ready for to control the variants as well as the developed countries, because we're not that equipped. We have a lot of challenges in our health sector, and as much as our governments are doing their very best to handle it, I wouldn't say that if we were faced with the numbers that the developed countries had, we would be sitting comfortably and saying that we'll be able to handle it and we're very well prepared. No, we'll do our best. But to say we're very well prepared, I must differ a little from my colleague, Dr. Vivek. I must say that, yes, there have been a lot of improvements, especially with the vaccination. We haven't had too many challenges with people in Ghana going for vaccination. Like I said initially, the education, the myths, the misinformation, coupled with our cultural beliefs and our religious beliefs and practices, made it very difficult to get the information to people, to explain to people why they needed the vaccines. But there was a lot of education, mass education on both digital media as well as the traditional forms of media in different languages. There were regular updates by the ministers and by our presidents. Every time there was a change, there was a regular update, and this helped people become more understanding of what was happening. So I think in terms of vaccination, yes, as many people have gotten vaccinated, at least one dose. Almost everybody has had one dose. Almost everybody above between 18 and 35 has had, and then those above 60 have had the doses. So that's where the strength is. But currently, there's been a reduction in the restrictions. Our last update, our president said that wearing of the mask was not mandatory, and not everybody seemed to be in full agreement, because we would have wished that they would have waited a little till there was no case or very, very low cases. We understand and appreciate that, yes, globally, according to the World Health Organization, globally the numbers have reduced tremendously, and in a very long time we don't have as many cases. And so yes, there's been a reduction in the restrictions, and that's where the challenge comes, because once you do your very best, would hope that you do your very best till the end. But not just Ghana. I remember last week I was speaking about South Africa. I was speaking on your platform about South Africa's reduction in restrictions, and I said the same thing, that I would have hoped that they waited till everything was completely done, also or completely out of dangerous waters. But Ghana has also done the same things, and so I would encourage African presidents that in as much as they have our economic well-being at heart, they have to look at how we're going to finance ourselves, how we're going to eat and everything. It's also important to prevent a reinfection by other variants, and I would hope that we don't completely throw caution to the wind, but we wait till we are actually secure, and then we can reduce the restrictions or take them off completely, as has been done in other African countries. But I think that generally, Africa has recorded very good numbers, and I wouldn't attribute it so much to how well we are doing. Yes, that's the percentage, but yes, we have been lucky too. I mean, if we look at it, we have been lucky because we haven't really been so stringent in the practice of our precautions, but we have just been blessed as Africa to have very low numbers, and so we can't take away the luck factor. But of course, yes, I've seen governments, and my government especially, put in more restrictions and put in measures to enforce those restrictions, and that has gone a long way to help us.
Well, it does seem there's not a consensus on that question that I asked about whether or not Africa is, in fact, on track to controlling the COVID-19 pandemic. But I do want to thank my panelists for joining me this afternoon to help us have that conversation about whether or not we are ready for a new variant or any other variant that may pop up and potentially cause havoc on the African continent. So thank you to Dr. Hannah-Lisa Tetteh and Dr. Vivek Solanki, as well as Dr. Uyilawal Okhuaihesuyi, for joining us for that all-important conversation.